Good morning, Grenada, Carriacou, and PT Martinique. A special good morning to all of you joining us on 97.5 City Sound FM, 89.5 CRFM, 92.9 Sister Radio broadcasting from Hillsborough, Carriacou, and of course 94.9 We Noise Radio out there in Brooklyn, New York. A special good morning to all of you joining us on the live videos. Remember to like the live, share the live, get everybody involved in the conversation. It is a beautiful sunny day this morning. And of course, we have to be grateful and thankful for life. Most importantly, above all else, we are grateful for life. But of course, the conversation must continue. We must come every day here if we have to provide as much factual information as we can to keep the country, the state, the people of Grenada, Carriacou, and PT Martinique involved in what is happening. All right? So we're asking everybody, just share the live, like the live, get everybody involved. Let everybody hear what's going on. Let everybody contribute to the conversation, Sometimes it's not about just hearing something and running with it or complaining about something, but it's also giving constructive criticism. A lot of us don't know how to give constructive criticism. We know how to criticize well, but we don't know how to give constructive criticism. All right? So we definitely want to open the lines very early this morning. Of course, it is Friday, so we want to invite everybody to join in on the conversation. This morning, we continue with the coronavirus, of course, because it is a matter of grave concern for not just us here in Grenada, but internationally. All right? So we want to continue the conversation with everyone. We want to hear what you're thinking. We want to hear where your mind's at. We want to hear how you are preparing, because, of course, from the very beginning, the message has always been preparedness. Be prepared. For any eventuality, you have to be prepared. All right? So we want to hear from you on what's happening on your end, what's going on your end. How are you preparing for an eventuality, in the event that we do get a case? How are you as an individual preparing yourself for something like that? All right, so we're going to open the lines very early this morning. The number to call is 440-7377 for local calls, 347-329-3101. If you are in the diaspora and you would like to call and contribute to the conversation, you are more than welcome to do so. We do have our first caller on the line. Good morning, caller. Hello?
Hi, I'm calling for the program.
Yes, you're live. Good morning.
Yes, good morning.
Good morning.
Okay, well, first of all, to answer your question, the way I'm preparing is practicing good hygiene, so sanitizing, not touching my face and so forth, and I'm trying to also stay out of, areas, populated areas. But I have a question.
Yes.
Since we're on the coronavirus, could you tell me, there's something we're not drawing with speculations, what's going on with the students that we have over in China. Why I'm asking about that, because we're seeing that they come into Facebook, stating that they have been neglected by the government. And I mean, it's not a good look. We're not pelting any stones. I love how you started off the program saying constructive. So you have any idea maybe what's the next move? Because they want to come home. So we just concerned about, what's in place. I mean, they are our students and they are our responsibility. So we want to know what's being put in place concerning them.
Okay. Thank you so much for your contribution, caller. All right. I want to touch on this for a moment because I know it's a matter of concern for a lot of people. I myself have family members who's studying in China that I've been in contact with, of course, who they are. And I want to say this. I want to start by saying this. The situation is a devastating situation. It's already an uncomfortable situation. It's already a situation where our students are frightful, where they are nervous, where they just want to come home because they want to go to a place where they feel like, okay, we're safe. There's no case of the coronavirus in Grenada, so when we go back home, we're safe. Now, I also want to make mention that the government of Grenada, above all else, will make decisions that they believe is best for the entire population of Grenada. And I want to repeat that. The government of Grenada, whether it's the government of the day today or the government of the day tomorrow, will always make decisions that will be beneficial for the entire population of Grenada. Now, with that being said, the information that I have as it relates to the students is that all of the students have been engaged in a WhatsApp group. They have been in constant communication with the embassy in China. There are some students that we have currently in Wuhan. Now, one of our biggest problems is that some of us here are adding a lot of stress to an already stressful situation for these students and making them anxious. The best thing for these students at this point is to remain in China. And this is in my opinion, simply because they run a risk of contracting the virus in transit to Grenada, thus exposing Grenada to a possible case of the coronavirus. Now, I know a lot of you out there may be saying, oh, well, anybody could come. Look, we have 3 Italians that are in quarantine and all of that. Yes, that may be the case. But that is a situation that we have no foresight into. So therefore, we must deal with it as it happens. Now, America went and they took their people, they evacuated their people from from China, along with a lot of other countries. And look at now, their situation is that they now have 60 persons within the U.S. that have the coronavirus, thousands of people under quarantine, thousands of people under observation in the U.S. as a result of the coronavirus. Now, I'm not saying that the students don't have a right to be concerned. They don't have a right to want to come home. They do, because it is a sad situation. It is a difficult situation. But we are not helping the situation by going on social media and talking about the government doesn't care about them and that the government is bad and that they must send a plane to take the students and bring them home. It's not helping the situation. What we are doing is adding stress and pressure to an already stressful situation. Would I not like to see my family members come home from China and know that they're safe? Yes. But we have to look at the risk involved in doing something like that. See, we act a lot on emotion, and that's fine. But at some point, we have to put that emotion aside and look at the thing realistically, logically, practically. In theory, it sounds easy. In theory, they can make arrangements with China, get a plane, send them back to Grenada, put them in quarantine for 14 days, and everything is all nice and dandy. In theory, that sounds wonderful. But in practicality, it may not be that easy. And that is what we fail to understand. See, everything has a process, everything has a procedure, and they must be followed. We can't just want the government to do something because we feel a certain type of way about it, or because we feel that they must do it, or because it's the government that sent them there, so they must take them out. We cannot act on these emotions. The students are not starving. The students are afraid, as they have all right to be. Because this is a scary situation. As of now, there has not been one student in China that has contracted the virus. And do you know why that is? It is because the embassy has been in contact with them. They have been constantly communicating. They are being encouraged. They are being motivated to stay positive. But when we attach so much negativity to the situation and feed it to them, all they can do is feel more afraid, and we are not helping. And I know family members are concerned because it's your family member, it's your daughter, it's your son, it's your brother, your sister, your best friend. But you adding stress to the situation, you adding negativity to the situation, it doesn't help. Now, if there is a real concern, a student it doesn't have any more food left in their apartment, they don't know what to do, they're at ends, they're in the line of danger, one of their roommates have it, then the best thing to do would be to contact or encourage them to be in immediate contact with the embassy in China, who is their closest source of aid at this time. When you sit in Grenada and you go on social media and you blast the government and talk about the students, what students? All of the students are not suffering. I've seen, I have family members in China studying. I have seen people with family members in China studying who is in constant contact with them, motivating them, who is saying that they are just riding the waves. One person yesterday said that the number of cases per day in China has significantly dropped. So there is a glimmer of hope that this issue would soon be eradicated from China. Their best bet is to stay put, because they don't know when they leave China what it is that they are meeting. They don't know when they walk out their doors to be evacuated what they're going to come in contact with. And these are the things that you need to consider. So I don't know, caller, what the next step for the government will be. I can't speak on their behalf. But I can say that I have faith that they are making the right decision. You know, we have to trust the people that we have put in power to govern us. We have to. Whether you support their party or not, it doesn't matter. You must trust that the decisions that they are making are prudent decisions meant to benefit the population of Grenada. And you know, it's funny because everybody in Grenada doesn't feel like the students should come home. There is just a handful. But what makes the difference is that they're very vocal. So people all over social media tend to believe that there is this big issue with the students and that the students are suffering, when that is far from the case. I want us to be careful in what we're doing. Are we really trying to help the situation? Or are we just in an effort to discredit our administration, looking for all sorts of negative things to dig up? We really have to be careful. Now, I want to give you your update. Of course, every day I thrive to give you your update on the coronavirus. As it stands right now, 83,906 cases have been recorded worldwide. There are only 44,176 active cases. So of the 83,000 cases that have been reported worldwide, there are only 44,000 active cases. The death toll is now 2,869, and 36,861 to be exact, people have recovered from the virus. As it stands right now, there has only been 44 new deaths in China. And I'm saying only 44, and some people may say 44 is a lot. It is a lot. But when you look at it in comparison to the population of China, the population of that particular area in China, It's not that much. And to note that it is significantly lower than the reports that they have been giving for the past couple weeks. So we have to be mindful of that. We now have 58 countries and territories around the world that have had cases of the coronavirus. And I'm going to list them for you. There's China, South Korea, Italy, Iran, Japan, Singapore, Hong Kong, Germany, the US of A, Kuwait, France, Thailand, Bahrain, Taiwan, Spain, Malaysia, Australia, UK, the United Arab Emirates, Switzerland, Canada, Macau, Iraq, Sweden, Oman, Austria, Croatia, Greece, Israel, Norway, Lebanon, Romania, Finland, Georgia, the Netherlands, Pakistan, Afghanistan, Algeria, Belarus, Brazil, Denmark, Estonia. That looks like Lithuania, North Macedonia, Mexico, New Zealand, Nigeria, San Marino, and wow, that's a kind of one. I think it's Azerbaijan or something of that sort. 58 countries and territories affected by this virus. What are we doing as a nation to prepare ourselves for that eventuality? What are we doing as a region? Because it's not just about Grenada, because the risk stands for any Caribbean country that they may contract a case of the virus. So what are we doing as a region to prepare ourselves for this eventuality? Have you been eating your fruits and vegetables? Have you been washing your hands? Have you been practicing coughing and sneezing etiquette? Have you been sanitizing? Have you been doing what is necessary to ensure that we as a people stay safe? Because there may come a time when these practices that we are doing right now will be absolutely necessary. We have a caller on the line. Good morning, caller.
Duncan.
Hi, good morning.
Everything okay?
It's good.
Yeah. Mr. Duncan, as Canadians, the World Health Organization and the government and the Ministry of Health, they give us some instruction. What we need to do proper hygiene, and we need to follow the guidelines. And this, like we say, the Ministry of Health and Power, they give us enough information. What we have to do to carry the proper hygiene, we have to follow it. Because sometimes people always look to criticize and sitting, but they don't follow the proper hygiene. And I want to say to Grenadians to obey instruction. Because say when you obey instruction, you live long. But when you disobey the instruction, you come like you're shouting right, because many things come when you disobey. So I want to say to the Grenadians, if you love yourself and you love your family, speak to them about proper hygiene. What do you tell it? Wash your hand. Whatever they do outside, wash your hand. That's the information we're supposed to give. Then going on Facebook and spreading a set of propaganda. Because look, you have the main opposition say that they got 20-something thousand votes in the last election. Did you ever hear they give out some, encourage them to what they have to? All what they encourage them to do is spread propaganda and hatred to the own countrymen. Because if you say you love people, you have to give them, encourage them to do things to save life and to protect them from getting the virus. But they don't have time for that. All what they have time to do to spread propaganda and to mislead even the supporters that they say that they care and they love. Because if you say you care and love people, you're supposed to mislead them, but give them proper information to help them go forward in life. Ms. Duncan, have a wonderful day.
You too, caller. Thank you so much for your contribution. And joining me in studio, of course, this morning is none other than Mr. Bola. Good morning, Mr. Bola. How are you?
Good morning, Miss Duncan. I'm absolutely well. I'm fine. I feel good about myself. I do hope that the listening public out there is feeling that good about themselves as well. Today is another wonderful day.
Absolutely. And of course, we are talking about the coronavirus again this morning because it is a matter of grave concern, not just locally but internationally as well. And we want to make sure that people go out there with the right mindset, with the right information, and spread the truth, and not make an already bad situation even worse. You know, we were speaking about the students in China, and one of the callers would have mentioned that, what is the government doing as it relates to these students? And of my opinion, and that I was giving, is that they are much safer there, staying put, because they have been there from the onset of the outbreak. Not one of our students have reported a case of the virus. And that is because they have been in constant contact with the embassy. They are being constantly motivated. They have been given tips. They are being given supplies that they need. And it's very disheartening when you go on social media and you see that people are just ranting and raving and talking about bringing the students home, and just emotional banter, that is not really helping to calm the already frazzled nerves of these students.
Well, Ms. Duncan, we discussed yesterday and many times before. Serious management and leadership is not about how much noise you can make, but it's about the ability to assess every situation, good or bad, and to make prudent decisions that will bring the best results. I am not in government, but I do know that the government is very concerned. In fact, while all of these noises are being made, the government is concerned about the well-being of the students. They are in contact. They speak through the Ministry of Foreign Affairs, the ambassador who is in China, who is in contact with the students. I mean, the students themselves would have revealed that, yes, they have the group chat, that they communicate on a daily basis, that most of what they need are provided for them. But we have to assess the situation as it is in China. We are not there, but we get the news. We see the news. And of course, most of us can imagine what the situation is like. Many cities are on lockdown, as we are told, meaning that people are not allowed to go in and out of those cities. And so even the Minister for Foreign Affairs, upon meeting with and having dialogue with the parents of the students who are still in China, and I think there are about 60 or so, 66, I think the number was. I hope I'm correct. There was that meeting of the minds. The parents were there. There were a lot of discussions. And some of the parents did admit in that meeting that their children are saying to them that they are safe, at least. They do not have all of the amenities, but they can get by, they can survive. Now, I would imagine, like anyone else, over time, you would feel a little frustrated. You are not able to go out. You are not able to do many of the things that you are accustomed doing. You can't meet with friends. You are more or less in a situation isolated, like you are imprisoned. And that can take a toll on you. That can make you feel. But we also have to assess what is best at this time. The health experts did say in the earlier days that what was best is that the children stay put, the students stay where they are, that they stay contained, because getting out, China is a massive place with a lot of people, billion plus, right? And I've been to China 3 or 4 times. It doesn't matter which city you are in, it's always crowded. That's a fact.
Yeah.
Your interaction with people, trying to be as careful as you can, taking all the precautions that are laid out to you, there's no guarantee that getting out into the open that you can be protected.
Yeah.
So we have been advised that the best way is to have them on lockdown, quarantine, isolated, stay away from the crowd until things can ease up, things can get better. But the government still doesn't sit by idly. The last I've heard, and I don't know if it is my place to make it public information, but there was some backtracking and behind the scenes negotiation with the authorities in Colombia, who themselves are attempting to move some of their students. Because mind you, it's not just Grenadian students that are in China, you know. There are so many countries that have students in China. I mean, thousands and thousands and thousands of foreign students are there. And most of them are still there. There are a few countries, including the United States, that in the early days were able, because they had the mechanism, they had the means, they had the aircraft and everything to pull their people out. We are not that fortunate or that wealthy. However, we are still very concerned and want to make sure on a daily basis, and information is being sent daily to and from as to the present situation. But there were some background negotiations taking place as to whether or not, if the Colombians are able to move their students, whether we can get some or all of our students moved out during that time. The other thing we have to know, and that is not a concluded thing, yes, they are negotiating. But even if they can, and even if they get out, when they get to Colombia, they will have to be quarantined for the 14 days before we can make additional arrangement to get them out of there. So that's one of the angles that they are looking at presently. Whether it would work or not, we do not know. The second thing that we have to assess, with all of the noisemakers and the naysayers and those who know so much that we can get house in Lansapina and in Grand Anse and wherever to house them when they come, that's easy to say. Now remember, the 60 odd students that we have in China are not all located in one city, or in the same school, or in one little village. They are spread throughout China, through many provinces. It can take you days to move from one province to the next. It can take you days to transfer from one train to another to get to the point of collection, to get to the airport. So the logistics of doing it is not just a sleep and awake. It's not a dream come true overnight. It takes a lot of planning, it takes a lot of preparation, especially in a chaotic situation as it exists now in China, where you are trying to keep people safe, to keep people protected, to keep people out of the possibility of getting into contact and being contaminated by the coronavirus. So, when you hear that it is safer to keep them there for now, these are some of the things that is being spoken about. Yes? There are a lot of internal flights that you may have to take from one point to the next. There may be students who may have to take 2 or 3 different planes, different aircraft, different internal flight. How many hundreds of miles are travel on train or buses before they can get to that central point where they can actually leave the mainland China. Yes? But outside of that, there are so many countries that have now closed flights and break ranks with China as it relates to flying. So there's that difficulty of which airline would you get. And if you get one that flies to some place, where is that place? Is it somewhere in the Middle East? Yep. Is it somewhere more dangerous? Is it somewhere that we can trust? What is it if it is in Iraq or in Syria? You can get a plane going from China to one of those places. Do we want to take the chance to send our students there? Where do we house them until they can get another flight out to some other Western state? I mean, there are a lot of considerations, and that's why I say management and leadership is not about the noise in the market. It is not about how many people open their mouth and trying to create pressure points by getting people to sign on to these what you call it now, what they're signing on to.
Petition.
This petition, sorry, the word just left my memory for a moment. And so, yes, all of that, maybe some of the people who are involved in that are genuine and genuinely concerned. Any parent will be concerned. I mean, do you think when you are in the army, whether it's in the US, the English, or whatever army, and you go out into one of those countries at war, don't you think that parents are concerned and worried? But that's the reality that we have to face. No one ever said that getting a better level of education was going to be easy. They have to study hard, and of course there are going to be tough times. Unfortunately, this is one of those that we have to face. And we have to sit and carefully plan out how best we can do this thing without exposing our students to the possibility of contracting the virus. So come on, yes, you can talk. You can say you want to know what government is doing. You want to know what plans are in place. Of course, it is your right to ask those questions. But stop behaving as though the children are just over there in Carriacou and you can send the osprey to pick them up. You know, or they down in Trinidad, so you can make a call to Liat and say we have 60 students on Piaco Airport, just pick them up and the government will pay. No. There are millions and millions and millions of miles away from us. Several flights, several airports they would have to transit through. Several trains, many of them would have to ride to move from one city to the next. That is on lockdown. So we have to carefully craft out the best possible way to move them without exposing them to the possibility of the disease. And as rightly said by Ms. Duncan before, we pray and hope that none of them ever gets into contact with one of the contaminated people who has the virus in China. But being on lockdown is the best chance of staying safe for the time being. And come on, people. Come on. You want a chance in government? There's a way to do it. You want to show people that you have the ability to lead this country, to bring growth and development, to provide better means of employment, to ensure that our people are safe and secure, that higher levels of education could be achieved. There's a way to do it. Come out, campaign, speak to people, go knock their doors, tell them what your plans are, have your own programs. Stop using a bad situation to make political gains, you know, to build your political career on that. That is being dishonest. That is saying to people that I don't really care about your livelihood and your security. What I care about is my popularity. It is not a nice situation. I am not happy about it. And I do not believe that any one of the 15 members of parliament who sits in the lower house, who would have gone to their constituents, who have knocked doors and got people convinced to vote for them, I don't think any single one of them is happy about the situation. I don't think any one of us, and I do really hope that there's not a Grenadian out there that wishes that that virus reaches our shores and affects and attacks any one of our citizens. I wouldn't wish that it attacks and affects even the person that hates me the most in Grenada. No. Because I believe if any one Grenadian become contaminated, contract that disease, all of Grenada will suffer. In fact, I spread it wider than Grenada and believe that anyone in the sub-region, anyone in the OECS, anyone among us, any one of our small island states, I think it would be easily transmittable to any of the other islands. Because we are so small. We are so interconnected. You know, we are so open as a people. What I think we need all to do, those of us who waste time making these videos and all kind of thing, cussing the Prime Minister and talking about what should and shouldn't, let's start educating our people about what we should do. Because mind you, while I believe and I understand the processes that the Ministry of Health goes through, and the frontline health workers and the doctors who continue to assess the situation, and the PR team and everybody else, while I believe they're doing their very best in terms of trying to follow the protocols that's been prescribed, to ensure that they tag people, that they test people, that they quarantine who they think is necessary to contain, I do not believe that these measures alone can definitely save us from having an attack. They can, of course, help us because we need to take the necessary precautions. But it is not only up to the doctors. It is not only up to the medical team. It is not only up to the Minister of Health or to the doctors that are on the front line and the nurses and other medical workers. It is not only up to the government. It is up to every single one of us as Grenadians to do our part, to play our part, to ensure, as we have been advised, that we continue to get adequate rest, more than we normally used to get. And as I've said to a group of people that we met just yesterday afternoon, over 200 of them at the Tivoli or the Sacred Heart RFC School, if we were going to bed at 10 or 11 before, maybe we'd start going an hour and a half before, because we are told that our bodies need sufficient rest to ensure that our immune system become much more robust, much more healthy. Eat proper foods, well-balanced diet, fruits, getting a sufficient amount of vitamin C, vitamin D, vitamin B. So whether we use fruits and vegetables or the foods that contain them, or we buy the supplements and use it, we should. We are advised that we should reduce on our alcohol intake, that we should increase on our fluid, especially water. Fluid meaning now water intake. So if you used to before drink 5 or 6 bottles, maybe you should double that. 8 glasses, maybe you should double that, because the more fluid our system is, the better it is for us. We are accustomed to washing our hands after using the toilets and other things. We have to do 3 times more washing with soap and water or using some alcohol-based hand sanitizer. This is what is being advised. That's what we must all do. That's what we must share. That's what we must encourage our children, whether they're in school or they are employed, our neighbors, our friends. These are the things that we should be saying to them, that God lot it if we should have a case here because of our hygienic control and because we are doing what we are told. We boosting our immune system by eating the right foods, our colored foods, and so by boosting our immune system by taking more vitamins and the supplements that we need, by drinking sufficient water, by getting sufficient rest, by reducing our alcohol intake, by doing the regular exercises that we should do. So we probably never used to walk on mornings, but we need to rise from bed half an hour earlier and do a half an hour walk every morning or half an hour walk before we go and sleep, so that our cardiovascular system can operate better and our bodies can become more robust, including our immune system to help us. Yes? They said we must use a lot of citrus if we can find them. Let us encourage people and tell people the things they should do. Let us teach people how to have better cough and sneeze etiquette, especially in public. Let us wash and wipe our hands more regularly and dispose of the tissues that we use to wipe our hands properly, so that it is not being reused by another person, unsuspecting that it was used by one of us who may have flu-like symptoms. Let us know that if we ever discover that we have flu-like symptoms or anyone among us, our family, our close friends, that we do not immediately send them to a health center or the hospital. Yeah. There have been numbers that has been given that we can call, and I think I had some of the numbers here, if I can find it quickly, so we can repeat it. They said if you do that, then the health practitioners can make the necessary arrangement so that just in case you may have contracted the virus, you do not spread it easily. Take the necessary precautions. Let us encourage our people to do what is right. Encourage our government. Tell them, look, we need to do more of this, or we need to do more of that. If we find that something that is happening is not happening in the right way, let's speak about it in a sane and orderly way. And let's stop this confusion and fear that we're creating. Yeah. Telling people, oh, there are so many cases in Grenada. Just 2 nights ago, a gentleman is telling me, oh, Mr. Buller, there's a case in Carriacou. I said, but where did you get that from?
I heard that on the bus going up yesterday.
Where did you get that news from? I said, if there is a confirmed case of corona in Grenada, Carriacou or Petit Martinique, the government is bound by law to report. So why are people spreading all these false rumors, being so libelous and trying to frighten the people of this country? Once the Ministry of Health can confirm, it must be reported to CARFA and the WTO and others so that they can send in the experts and help us. The government is doing what they should. And people are talking about, but they're not telling us. They can't tell you everything. There are certain things that they're doing, and yes, of course, we must report to the people and we must delay fears in the minds of the people. We must make people know that the greatest concern of the government is for the welfare and well-being, because this is also an issue of national security,
Yes.
The issue of protecting our people from catching the coronavirus. This is also an issue of productivity, because if it comes to Grenada and many people get infected, I mean, let's think about Zika and chikungunya and all those things that a small section of our population had, and the effect it had on us, because so many of our people could not turn up to work and everything else. So it is a major concern for the government. It is a major concern for nation building and, of course, economic growth. And the government is quite aware of that. And they are doing everything within their powers, following the necessary procedures and policies that are set down to ensure as best as possible that they can prevent this virus from coming here and they can protect the people of Grenada, Carriacou, and Petit Martinique. But just to give the numbers, you can jot it down, those of you who are listening. 440-2649 is one of the numbers that you can call during the regular working hours. If you tell yourself that you've been exposed, or you've been to a place, you've been to a country, as we've said yesterday and days before, that there are presently now over 50 countries and growing that has had confirmed cases of the virus. You may have been to one of them outside of mainland China. You may have been in contact with people who came from one of those countries. And chances are, unknowing, you may feel like you probably might have contracted something. You may be experiencing flu-like symptoms. You may be having headaches or dizziness or coughing and sneezing. And if you experience those symptoms and you feel to yourself that it may be something along those lines, the Ministry of Health is urging you, please call, and they can make the necessary arrangement to have you picked up, to have you isolated so that it doesn't spread. As we said yesterday, Vietnam, for example, had 16 cases. Yeah. They were all cured. No one else in Vietnam catch it because the people understood and performed and functioned as they had to. Having contracted, they knew what to do. They followed the protocol. They didn't go on social media cussing the government and saying the government was responsible for them catching it. They recognized that it's something that is out there. It's a viral attack. And if one has it, these are the protocols that you must follow. So 440-2649 is the number that you call between 8 to 4 if you believe that you have any symptoms that are flu-like and you don't trust and you want to be checked out, right? During normal working hours, 440-2649 between 8 to 4. Now, after 4 p.m., you can call 417-1079, 417-1079, or 417-2562. Now, if you call any of those digits, someone will be at the other end to answer you. Some arrangements will be made. Some sort of testing will be done, and the results will get to you. Maybe you may have to be isolated if that is the case. But by so doing, you will be saving hundreds of lives, including yours and that of your loved ones, your family, your friends. So please, let's share what's necessary, what's important, what can protect us. The noise that we're making cannot protect anyone from contracting coronavirus. The noise and the videos and the falsified information and the libelous things that we're saying will not protect any one of us from an attack by coronavirus. What will save us is by practicing the necessary things that we should do, the cough and sneeze etiquette, washing our hands more often with soap and water than we ever used to, staying away from crowds. They're even now advising, even in churches and other places where we meet people, that we probably just simply give a bounce rather than shake hands. Because while it is true that if you shake the hand of someone who may be contaminated with the virus that you cannot just catch it because it is not possible to penetrate the skins of your hands. But if you use that same hand that the person may have sneezed in or coughed in and transmitted some virus into their hands and got onto your hand, and you put it in your mouth, your nostril, into your eyes or so, that's the windows or the doors through which it enters your system. That is why you are being asked to wash your hands regularly. That is why you are being advised to stay away from large crowds. That is why it is you're asked to perform good coughing and sneezing etiquette. Don't sneeze and cough into your hands, into your sleeves probably, into a tissue that you should dispose of properly immediately after use. Let us practice those things. Let us teach the younger ones those things. Let us encourage those things, because by so doing, we stand a better chance of protecting not just ourselves and our family, but entire Grenada. We stand a better chance by limiting, if we should ever have a case here, by limiting the number of cases that can spread throughout the island. If we practice those things and boost our immune system, make it very robust, we have the possibility of fighting the disease, fighting the virus if we ever contract it. Over 32,000 people have been cured from it. Not because there is a vaccine, not because they have been given special medication, but because the immune system was able to resist and fight the virus and heal them. So too, if we practice and do the correct things in Grenada, we can ensure that this virus, if it ever gets here, do not reap havoc on our society and our people.
Absolutely. Very well said, Mr. Bowl. And I hope that the people who are supposed to be listening and the ones who are making the most noises are the ones listening to this, because I've seen some very silly comments, some very silly responses. Somebody saying that bring them the island that they could have been quarantined on, we sell that. I mean, it's things like this that make me wonder sometimes if people really think before they say certain things. So
Which
you want
island is that?
I don't know, but you want to take the children out of China, where they are right now. As it stands right now, the students are safe. None of the students have the virus. None of the students are in a situation where they are directly exposed to the virus. So they are safe. You want to take them out of China and bring them and put them on an island, most likely under some tent to sleep or something like that. And that's the mindset of the people. And that goes to show that their main concern is not to get the students out of China, because had that been that person's concern, they would not be mentioning some island that has been sold. No, what they're looking to do there is to put into the minds of people that the government is not capable of doing certain things and the government is the one ruining the country. No, it is mindsets like yours that is ruining our good country. And there are people asking, well, where is the quarantine point? Well, why do you want to know where the quarantine site is?
Maybe they want to be quarantined.
Well, it has to be
the
something
Ministry
like
of
that.
Health officials know.
And that's all who needs to know.
If you, by some way, contract the virus, and you have to be quarantined, they will quarantine you. That is not what we should be concerned about.
Of course not.
What you need to be concerned about is, are you practicing what you need to practice? And you're not talking about what we should know and we shouldn't know and what we should see and shouldn't see. There's a nice piece here from the Director General of WHO. He has addressed and said so many things, and I wanted to just read a piece that he says here, and let me take it somewhere from the middle. He said somewhere here, and I'll take it from somewhere in the middle from his address and try to read what he said. So bear with me a little bit. He said, does the virus, meaning the coronavirus, have pandemic potential? And he said, absolutely. It has. Are we there yet? And he says, from our assessment, not yet. That is critical and important. It's like people are saying in Grenada, do this, do that. Yes, we may have to, but are we at the point where we should be doing?
No,
I
we're
don't
not.
believe it is yet. Our medical practitioners and professionals knows exactly when to put what measure and procedure in place.
Yeah.
So here's the Director General speaking. He said, for the moment, we are not wrestling the uncontained global spread of this virus, and we are not wrestling large-scale severe disease or death at the moment, for the moment. And then he goes on to say, does the virus have pandemic potential? He said, yes, it does have that potential, but it's not yet a pandemic, right?
Yeah.
It has, and we are not there yet. So that is from their assessment. So how should we describe the current situation? This is the Director General of WHO, the World Health Organization, speaking here. I'm reading what he said. What we see are epidemics in different parts of the world, right? Affecting countries in different ways. Very important for us to understand that. And requiring, that is the most important part, a tailored response to each country. Right?
Yeah.
So what is happening in China is not happening in Grenada. So the response in China will be different to the response in Grenada. I want to read that part again. What we see are epidemics in different parts of the world, affecting countries in different ways. So what has affected, and the number that has been affected in Vietnam, for example, is different to what was affected Russia. Russia had only 2 cases. Or India, who had only 3 cases, yes? So he said it requires a tailored response based on what is happening. The sudden increase in new cases is certainly very concerned. So he was then talking about the increase in other countries, because for a while we were about 30-something, now we are up to 50. He said this is something for concern, right? He said, I have spoken to constituencies about the needs for facts and not fear. So absolutely important. And I thought after I read that, I wanted to share it. That's the Director General of WHO saying he has spoken to different people, different countries, different constituencies, different groups, different institutions about the need for facts and not fear, which is what a lot of people is trying to do in Grenada, create fear. And you must stop. Speak facts, write facts, share facts, not fear. Yes?
Yes.
He said that we must focus on. The time to focus on what the world should do. And he gave 3 priorities that the world should do. He said when we spread fear, that will not prevent a single infection, right? Or save a single life. When we spread fear, the Director General is saying, it will not prevent a single infection, which is what we have been trying to say time and time again, or save a single life. This is a time for all countries, all communities, all families, all individuals to focus on preparing.
Yes.
Not my words, the words of the Director General of WHO. A time for all countries, communities, families, and individuals to focus on preparing. Some of the things we spoke about, doing the things that are necessary, eating well-balanced diet, boosting your immune system, drinking sufficient water, reducing your intake of alcohol, getting sufficient sleep, getting exercise, practicing coughing and sneezing etiquette, especially in public, washing your hands more times than you normally used to with soap and water or with an alcohol-based liquid, and ensuring that if you feel sick, if you feel you have flu-like symptoms, that you don't rush into the emergency room where there are hundreds of other people waiting for things, or rush into a health center where you may stand the chance of spreading the virus if that is what you have. But call the numbers which I gave earlier on and ensure that you speak to a medical practitioner who would advise you on how to go. And right at the very end of the speech, because he has said so much more, but I just wanted to highlight those few things. He said, this is a shared threat. We can only face it together, and we can only overcome it together. not by segregation, not by you feeling that you support one party and you don't support the ruling administration. So you must say things to create chaos in the country. It's a shared threat. It doesn't decide. It doesn't discriminate. The virus doesn't say that I'm attacking people who wear green T-shirts and I'm going to save people who wear yellow T-shirts. It doesn't do that.
Yeah.
It don't discriminate. It attacks people. If it gets here, it will attack Grenadians. If it attacks an NNP family first, there is no way of saying that it would never attack an NDC family after.
Yeah.
So we need all to protect ourselves and protect each other. This is a shared threat. We can only face it together, and we can only overcome it together. When we act together, countries, as a region, globally, as communities, health organizations, the media, or the private sector, and people everywhere, our collective strength is formidable. Alone, we lose. Together, we win. I hope this would touch probably the hearts of some people who are out there spreading all these useless things, creating fear instead of sharing facts, sharing fear instead of sharing facts. The Director General of WHO, the World Health Organization, says this is a shared threat.
Yes.
And he's speaking globally. I am bringing it down to our country now. I'm not even speaking to the region. I'm speaking to the people in Grenada. The coronavirus is a shared threat for all of us in Grenada. And so we have to fight it together. The virus doesn't discriminate. It doesn't look at face. It doesn't look at color. It doesn't look at religion. It doesn't even look at sex, male or female. It doesn't say you're a child or an adult. It will attack you if we put ourselves in the places where it can get to us. It doesn't look at political affiliation.
Yeah.
So why are we trying to separate our country? Why are we trying to make it look as though Dr. Mitchell and the NNP is the one wanting to bring coronavirus here to attack the opponents, to attack the opposition? Let us recognize that the best way to deal with it is to do it together. He said, alone we will lose. Together we can win. Because we are a more formidable force if we are together. Let us concern ourselves and listen to the authorities. No one is saying that you have to change your political affiliation. No one is saying that you immediately have to start to like Dr. Mitchell if you doesn't. No one is saying that you have to obey Roland Bola because you never liked him. No one is saying that you have to change your allegiance from whatever support you had before to become an NNP. All we are saying is that we must look at this as a threat to our nation and our people. We are saying that together we must share the relevant facts and information and stop creating fear. Mm-hmm. We are saying together we must make each other know the things we are supposed to do to protect ourselves. Together we must try to prevent as much as possible anyone or anything coming to this country that has a possibility of bringing the virus. Together we must support our health team, our minister, our doctors, our nurses, our orderlies, all of those ambulance drivers, all of the people that put themselves at risk every day, trying to ensure that at our ports of entries, they test everyone who is coming in, that they have surveillances up, that they quarantine those and continue to check them while they are in quarantine. Let us pray for them. Let us encourage them. Let us thank them, because that's the only how we will beat that virus back, by acting together. At the end of it, and we clear it up, you can go back to your old self. Hopefully you will learn from the experience and be a better and more positive individual and share positive facts and talk about positive things and look at how together as a country we can go forward and we can build. But no one is obligated to join any political organization. No one is saying that overnight you must become an NNP and start wearing green T-shirts and waving flags and carrying the photos of the members of parliament.
All right, I want us to take this call because I believe I know who it is. Good morning, caller.
Hi, morning.
Hi, good morning.
I'm on the radio.
Yes, you are.
Oh, sorry, I think I got the wrong number.
Okay.
But you can share something, the fact that you're there. Oh, she's gone.
She's gone.
With speed.
Yes, go ahead, continue.
Yes, so I'm saying that in the words of the Director General of WHO, let us see this thing as it is, not as we make it. Because most of us are making it into a political issue. We are creating a division. We're jumping on the bandwagon and using this virus as a weapon, a political weapon, to divide our people and to create fear. And I think the fear itself may probably take the lives of more people than the virus can.
Let's take this caller on the line. Good morning, caller.
Good morning, Ms. Duncan. Good morning, Mr. Bowler.
Good morning to you, sir.
Good morning, the Grenada, Carriacou, and Pichi Martinique. Mr. Bowler, whoa, I think Trump had to hire you.
For what,
I think
sir? Trump might put me in jail, eh, Papa, so let's leave that there.
Now, where do I start? Well, sir, the amount of information you give now there is nothing contrary or different to what is the reputable sources of media organization like the CDC and the HHS in the U.S. has been putting out there for weeks now.
Yes, sir.
All right, as in the fact of hygiene. It's all about hygiene, our hygienic practices, and our awareness. All right?
Yes, sir.
So you didn't put anything that's different or made up or anything like that. That's it. Now, people that reside out of Grenada,
Yes.
for instance, here in the U.S., that takes it upon themselves. First thing they like to say, we have freedom of speech.
Yes.
Yeah.
All right? And utilize Facebook and Twitter and Instagram and those mediums to basically assassinate our country.
Yes.
All right? Especially now using this virus right now.
Yes.
They have to understand, Facebook did not pay $280 billion most recently because they were violating or they didn't have the right for this freedom of speech, if I may say so.
Yeah.
Okay? Freedom of speech comes with a level of responsibility.
Absolutely.
Not because you have the right to speak doesn't mean you could stand up in a theater and scream fire.
Yes.
All right? Now, all the things that they're saying and they're blaming the government, I mean, I've seen it. I refuse to go on Facebook and so forth many a time because of those things.
Yeah.
I cannot see any of them stating. One of the persons who does, I seen put up something about, I think it was a week ago, who works in Bellevue Hospital right here in Manhattan, in the city,
Yes.
where there is many cases of the coronavirus. Why she didn't say that?
No. They won't.
Why didn't she say that they cannot even come out of the hospital and protest the fact that they have these people in there and they don't know who they are, they don't know what area in the hospital they are, and they cannot go finding out those information. Okay? But they're instigating for people in Grenada to find out where's the quarantine point, who they have in quarantine, why they have them there, and all these kind of nonsense.
How does that prevent them from catching coronavirus? I don't know.
I don't know. What that does is, in the event that it was to come into our country, that will only help it to spread.
Of course.
That is what it's going to cause. Right? Our country, we are a people of closeness.
Definitely.
God forbid one case of this comes into Grenada. Do we understand the ramification of how quick it will spread?
Nope.
We play with our kids. We hug our friends. We sit and we talk and we hold hands with our grandparents and aunties and all the people, that's older than us. Do they understand that?
That's what we're trying
in
to get
Iran.
them. Yes.
In Iran, as of yesterday, the vice president of Iran of women affairs and that's her portfolio. She has contracted the
Well,
coronavirus because she was out in the front line assisting.
prior to her, the deputy minister of health in Iran also
Him too.
contracted. Yeah,
Yes.
and that was
Right.
days ago. Yes.
Now, there are cases in the U.S. where the people hasn't, up until yesterday or the day before, there was confirmed one case. There's others, but they only confirm as one. That the person never left the state of California. They never left the district they live in.
Yep.
They have never really moved around much other than, regular job or whatever, supermarket, whatever they do. But they have they contracted it.
Yes.
Where did they get it? Nobody yet to know.
Nobody yet.
Right? So that's a mystery right there within itself.
Yep.
Okay? Also, upon viewing something on BBC a couple of days ago, what we're not understanding, man today is traveling further into the depths of forests.
Yes.
Densely forests. That is how the coronavirus came about. Because someone went into the depths of the forest to get these exotic pets and bring it into civilization.
Yep.
All right. So we are traveling further into territories that we never used to venture on before. So now we are coming back with things that was never there before.
Yep. And some
All
of them
right?
unknowingly, yeah? Some of them
Unknowingly. All right. So that's where we are with this thing. Now, how I've been looking at Facebook and for the first time in weeks to see who is going to speak on it. The same people that is so eminent about the government of Grenada is not doing nothing and they do and all the nonsense. All right? As of last night, it is said on MSNBC and on reputable media sources, which the President of the United States like to say is for fake news and all of these people, that the Trump government overrode a declaration by the CDC to not go into Wuhan and take people out of Wuhan.
Okay.
That they decided that as president, he could order people around and make them do what he wants, because that's the reason why he's putting these cronies in office so that they could do as they are gophers. Go for that, they run. Go get this, they run. He sent a contingent into Wuhan without protective gear. And I'm not saying it because that is what I am assuming. That is what is said.
Was reported.
It is reported, they had nothing as in the form of protective gear to go into Wuhan, into the mega of the beast and extract these people. They brought them into the U.S. we arrived back into the U.S. yesterday morning, day before, all right? They did not quarantine them, and as of yesterday, the same folks who went out there and get these people went back to work in the different government offices where their jobs are.
Oh, Lord.
Are people understanding this? Right? The same president who is standing up in front of international media sources and say this thing will disappear by April.
Well, if we know the man is a crazy man, I don't know why people listen to him, That's the same man that's...
You ever heard the saying that even a fool have believers and followers?
Yes.
And they have them in abundance?
Yes.
There we go.
Yes.
Right? Trump stand up in different rallies and he preach, we're going to just take down Obamacare and we will build a wall and we will do all these things, and you see people cheering. Yeah, you see blacks, you see Hispanics, you see Caucasian, you see all race of people standing behind him and they're cheering because of hatred. Folks have to understand that. Okay? What we've seen in America today, it is hatred rising up.
Yep.
Millions died in 2 world wars to stop what is happening in the U.S. and other parts of the world today.
Yep.
Millions died to stop fascism.
Yeah.
That is the face of fascism today, as we've seen it. Okay, many of us didn't live through Hitler and through Mussolini and those leaders' days, so we didn't know it then, but we've seen it today.
Seeing it reappearing.
Right?
Reoccurring.
It's reappearing. Now, the same people that are sharing to dismantle all these things in the U.S., it's now beginning to affect them.
Yes.
Because they thought Obamacare was only health care for blacks and minorities.
Yep. Like some of
They
those
did not.
who on Facebook and thing now thinking that if coronavirus should come to Grenada, it's only going to affect the people who are supporters of
The
the
people
new
are
national
supporting
party.
of the government.
Yeah. I mean,
All right?
that's strange.
It's the same thing. And to build a wall, the government does not own the land across between the Mexican and U.S. border.
Yeah.
So now he is confiscating people's land, private land. Now you hear there's a big war with him and the people on the line on the forefront because they do not want them to take their land, but he has sent out his team of people to take their land. But it's the same thing they were cheering for, to build a wall. They're cheering to get rid of Obamacare. Now they're getting letters now that even when they go to the doctor now, it happened to me. I went to the doctor 3 months ago, and the doctor said, oh, well, Mr. Gibbs, the doctor will see you today, but after today you have to find a new doctor. Because your insurance does not accept they close the window out on that doctor's office. It could be for various reasons. It could be for late entries of billing. It could be for overbilling. It could be for wide numerous of things. But it also that it has to do with what they are doing, what this administration is doing to the healthcare, these little healthcare services that this country have. You hear a lot of nationals of Grenadians, Grenadian heritage, out here talking about, the government didn't do nothing about the hospital system in Grenada, and they didn't do nothing about this and all of that. Ask them when they go to Kings County how long it does take them to see a doctor. Ask them how many times some people go to Kings County, sit in Kings County and other hospitals in Brooklyn, spend 12 hours and 24 hours and have to get up and go home.
Yes.
Because the pain stopped or the headache stopped and they haven't yet to see the doctor.
Okay.
They won't say those things. Right? But they're chanting all these narratives and negatives in a country where they claim they love so dearly.
We get it.
It's frightening.
We understand, bro, and that's why we're trying to share the facts and trying to get people to understand that, hey, we have to fight this thing together. Whatever your political
That's the only how.
affiliation, that's up to you. Let's do this for Grenada's sake.
At the end of the day, it's Grenada we have to is our major interest here.
Definitely.
It has nothing to do with a long party line. It doesn't have to do with not liking your neighbor. It doesn't have to do because this one has more money than that one. It has nothing to do with none of those social aspects that we seem to be creating these problems in our daily lives about.
Yes.
Yeah.
It's about the survival of a country because if this thing hit Grenada, we have a lot of senior citizens.
Yep.
Did they ever stop to think it hit Grenada how much funerals they go having? Another thing I've heard
is...
is...
have funeral because you might not even be able to go to funerals.
Yeah.
That's the point.
We might
Because
be
you
able
hear
to
them
go.
say about... Yeah, they say that, the government not closing the airport. Ask them if the same ones that on Facebook, ask them to take a picture in JFK or LaGuardia Airport or any other airport in this country and see if you're going to see anybody with mask and protective gear walking around the airport.
Yeah.
Yeah.
There are cases in Long Island where they have 83. I don't know, as of yesterday, the numbers were 83 people quarantined.
Yeah.
Yeah.
All right? Someone said to me, show me an area and say, that is the facility where they think they have the people quarantined. You don't see people out there with guns or,
Yeah.
safeguarding and people going in with masks and all these things. Right? Now, are we still stopping to think that when we close the borders, we close the pier, we close the airports, what's going to happen to our infrastructure, as little as it is? What do you think is going to happen? What's going to happen to the busmen? What's going to happen to the taxi drivers? What's going to happen to the airport workers? What's going to happen to all these people who rely on those functional wheels for the daily bread?
That's why I continue to say leadership is not for those whose mouths are large to make the most noise.
Or louder.
It's for people who can, in crisis situation, sit quietly, assess situation, and make prudent decision. Because all of those that are calling for this, that, and the other, they don't know the consequences down the line. They can't see into the future. Their views are so myopic that all they can see is just the toenails and not 1 inch further. Yeah. So hence the reason they are not in government, they are not in leadership, because they cannot deal with situations like this.
The media, the different media houses agree. Media has become so reachable now that back when we were growing up, we listened to BBC World News, we listened Radio Antilles News, whatever, Grenada News, whatever. That was it, right? We couldn't go online and log on to CNN and get any breaking news about nothing. We could not do any of those things, but we were well informed.
Yes,
because when I remember they used to send they send me if I go into town and I had to get a newspaper by right.
Yes.
Right? You're not going and pick up one newspaper and go home. They want a copy of every newspaper.
Yeah.
And you sit down and they read all the different. Sometimes 3 papers have a article on the same story, but they read it and come up and form a better understanding of this. What happened?
And then there used to be discussion, and neighbors used to discuss and
talk about
they just
stand up and talk.
You don't have that anymore.
You don't have that no more.
And as a matter of fact,
we are in the age of intelligence, but where are our intelligence going? Where is it?
Well, the intelligence that they talk about nowadays are in the gadgets that we use and not in the people.
In the gadgets.
Anymore.
Yeah. I always say to people, we have smartphones, but they never say we have smartphone users.
No, not at all. Not at all.
Okay? We like to buy the smartest phone and the most recent phones or tablets or iPods or computer, but we are not utilizing it in the manner in which we could educate ourselves better.
Yep.
Yeah.
Or keep ourselves more informed better.
Yeah.
Because if it ain't juicy, we have no time for it. If you're on the radio and you're raising hell or creating bacchanal or making confusion, me, I ain't listening to you. I called a friend of mine here in Brooklyn yesterday, and I had a conversation with him pertaining to do with what he does online in himself. Because someone called me and said, call your friend and say to him to be very careful. And he said, and he started. I said, but big man, what's happening? No. I was advised to give you a heads up, and that's all I'm doing.
Yes.
Okay? As man to man, as friend to friend, that's all I'm doing. Because we had that conversation. He and I had that conversation on numerous occasions.
Okay.
But when folks don't want to listen, you can't force them to listen.
Of course not. Since we were young growing up, our parents used to say it to us, where our head leads us, whatever is behind us will pay for it.
Yeah. But we both going to pay for it.
Yes, of course.
Yeah. They say hard head make room for soft bottom.
Yeah, right. We understand that. But bro, today was a nice conversation, but we kind of running out of time there.
Yes, time has passed.
To the time, but it was so good listening to you, and I'm glad you had an opportunity to express yourself and to talk, because that's what we want people to understand, that, hey, we are not going to muzzle anybody. Ask questions, talk, say what you want to, but do it in a responsible, respectable way.
We be responsible with it.
Bring facts, not fiction and fear.
Yeah.
So we appreciate
and that is very important.
And we thank you. So you go ahead, have an enjoyable Friday afternoon, a wonderful weekend, I would hope, and let's pray, God, that this thing doesn't hit us at all, and it doesn't continue to
spread, just pass.
And that within a reasonable time that those who are working on probably trying to get a cure, a vaccine or whatever, that they will be successful. Thank you again for all that you have shared with us.
All right.
Indeed, indeed. Have a great day, everyone.
Thank
Bye-bye.
you. Thank you. Bye-bye.
You know, something the caller spoke on that I really want to touch on, and it was something I was planning on touching on this morning, is that case in the U.S. where the individual had not left the state. They have not had any contact with anybody that had been to any of the places where the virus has been present. Yet they come down with a case of the virus. And I want to read to you what the report says. It says the U.S. CDC initially declined. Oh, I'm sorry. No, that's not the one. I apologize. It gets it gets all mixed up. Right. So the U.S. CDC initially declined to test the patient on February 26th. That became the latest confirmed case in the U.S. and the first with an unknown origin of infection.
Yep.
Which means that she has not come in contact with anybody who has been to, that she knows of, which is important, that she knows of, that has been in any of the places. Now, what their biggest concern, and it says here, raising the concern that there are more cases circulating among the general public that have not yet been identified.
Discovered.
And that is in the US of A. So we have a fundamental problem in the US of A where the first mistake that they would have made was to overrule the CDC's ruling and brought their people home from Wuhan. And that is where their problem started. So now you have an issue in the US of A where they themselves may find themselves in a situation where the virus becomes as uncontained as it was in China.
In China. And not just only moving people from Wuhan. Remember the case with the Diamond Princess, that vessel, that tourist ship.
Yes.
That was quarantined outside of Japan. And they went in, took on their own and removed their passengers or the passengers that are of U.S. origin, brought them back and later found that between 8 or 10 or 11, whatever the number of those people were contaminated with the virus. So, I mean, sometimes we have to use our intellect a bit more and not allow our emotions to take charge.
Yep.
So these emotional individuals that are out there making noise, this man who has been on radio calling Dr. Mitchell an old wicked man and him bringing the Grenadian students home, he probably don't ever read any of those things.
No, he does not.
He probably is not up to date with any of those things.
And he wouldn't share it because it doesn't feed into his narrative.
It doesn't give them the fighting and biting edge that they want. And that is why we say to you from this program that when you listen to those people, listen to their tone and listen to what they're saying, they're not going to bring you facts. They bring you what suits them, what will create fear in your mind, what will give a picture of our government as being a biased and wicked government. But I know, and I can tell you, and you can test it. You can test it for yourself. There is not another group of people calling themselves a party, a team, or prepared to get into government that is more caring, that can do better for Grenada at this time. I'm not saying that there may never be, but presently, Grenadians, your best hope for economic prosperity, for growth, and for protection and prevention of the coronavirus is the new National Party administration. As we have said earlier on, our health practitioners and the Ministry of Health officials are doing everything that they know how, based on protocol, to protect and prevent or to reduce, I should say, the possibility of having this virus come here to Grenada. But we don't know how, we don't know when, we don't know who may be able to walk through and bring the virus here. So our next best chance is for us as a people to adhere to the protocols that are laid out. Do the things that we are supposed to do, the things that are within our control. Protect ourselves. Make sure that our hygiene is at top level. Make sure that we do the things that they have asked us to do. Drinking sufficient water, reducing our intake of alcohol, having sufficient rest, getting exercise, increase our intake of vitamins through fruits and vegetables and food, help and our immune system, that it can become more robust so it can fight the infection if we should ever have it. Prepare ourselves. Store water, have soap, wash ourselves regularly, our hands in particular. Do not rub our hands into our eyes and our nose and our mouth after getting in contact with other people, especially people whom we know had flu-like symptoms. Yes? And if we do find ourselves or any member of our family or within our neighborhood that have these flu-like symptoms, that are complaining about dizziness, about headaches, about not feeling well, do not rush them into the emergency room or to a health center, but call so that arrangements could be made for these people to be carried in a separate place where they can be tested to ensure that if by some magical means it is the virus that they have, that they do not contaminate the rest of the people in this country. I will try once more to just give you the numbers that you can call if you find someone, and these are the protocols that you must follow. These are the things that are going to save, protect, or prevent us from probably spreading the virus if it ever comes to Grenada. These are the things that are going to ensure that we do not, as a people, help to spread this danger and this disease, and not the fear-mongering and the loud-mouthing and the hard-talking, but of course, trying to do what is right. And for some reason, it's not coming up on my device again. So I didn't write it down. Unfortunately, I have it, but you know how these smart devices play games with us all the time. I mean, now that I just need to share the numbers again, it's not there. So I apologize for that. But I say to us, it was a pleasure being here. It was a pleasure talking to you, talking with you, sharing information that I believe is practical and factual with you. We are approaching the weekend. Things continue to happen. Issues continue to transcend the internet and other places. Read as much as you can, but of course, verify and try to share only what is factual. Try to listen and to go to the websites that are authentic and are sharing news that come from the WTO and other regional institutions that would make us much the wiser. Do try and have, it's Friday, an enjoyable weekend. Of course, as we say, it's a time when people party, have fun. Be extremely careful. Consider the amount of alcohol intake that you have. Stay hydrated. Continue to stay hygienic as well. Washing your hands regularly. Keeping away from people that have flu-like symptoms. Protecting yourself. Eating a good balanced diet. And of course, trying as much as possible to strengthen your immune system so that if at all this virus ever comes here, we'll be able to fight it. Share with your friends and family, share with your neighbors, and make sure that Grenada continue to be a prosperous and productive country where we are one for all and all for one, together fighting what we believe is a scourge that is here to attack and to break us. God bless you. Enjoy your weekend, and hopefully, if I survive it, we shall be able to talk to each other on Monday again. Be good and take care.
Absolutely, guys. We have come to the end of our program today. So in whatever you say and whatever you do, be safe, be secure. We always want to be talking with you and never about you. Enjoy the remainder of your day.
You're listening to Hard Talk Grenada via www.hardtalkgrenada.com.
Stay up to date with all that's happening with the new National Party, NNP. Send us a message via text or WhatsApp on 405-8683 with your name, email, and constituency. Stay in the know with NNB. Get updated.
Government partners with cybersecurity program to encourage safer online activities. We'll have details to this story and more in the National Report. With the details to the news for Thursday, February 27th, 2020, I am Rakisha St. Louis. Eradicating cybercrimes and building a safer online community has been a topical issue in Grenada for years. Grenada now has its online platform to share information and create public awareness on internet security. The government of Grenada has partnered with Get Safe Online UK, a Commonwealth cybersecurity program, to learn more about online threats and ways the citizens can be protected. A team is currently on island conducting a cybersecurity workshop with students, IT personnel, among others.
The perception is that young people know a lot more about technology than my generation, and that's true to the extent that they know how to use it, but the question mark is, do they know how to stay safe whilst using it?
The workshop covers protection of computers, smartphones, protection through online banking and payment, social networking. According to Bayer, the workshop is a reminder that online protection is not guaranteed. Other people can have instant access if there is no protection.
The issue is we're not bringing skills to Grenada because Grenada has plenty of IT people. They know exactly what they're doing. What we are bringing is expertise from, or not expertise, but experience from a country that's been hard hit by cybercrime, to try and give the islands a heads up that, look out, this is coming. Because in terms of what we would call real world criminality, so offline criminality, historically you've been protected by hundreds of miles of sea. It's quite a financial investment for a criminal to actually come here and commit crime. Well, now you've got effectively a land border with the rest of the world because they're right on your doorstep. So you haven't got that protection anymore.
He stressed the importance of having a password for every online account.
The password thing, it's been obvious when we've moved around that people talk about their password singular, and it should be passwords. You need a different password for every single account that you have online. Clearly managing that is a problem, but when we've been doing the training, we've been highlighting methods you can use to either remember it, or if all else fails, write it down, but make sure you write it down and put it somewhere safe. The difficulty is if you only use one password, if somebody manages to break that and gets into one account, then they've got into all your accounts, and that leaves you financially extremely vulnerable.
The Public Utilities Regulatory Commission, PURC, is hosting a series of consultations to discuss draft regulations for the electricity sector. The 9 documents include draft regulations on rules and procedures for applying for license and permits, draft regulations on tariff setting methodology, and the Grenada Electricity Sector Grid Code. The consultations, which will begin on Tuesday, March 3rd, will also be taken to residents of Carriacou and Petit Martinique. Dr. George Matthew, acting CEO of the Commission, says these regulations are not just for the country's electricity company, and as such, everyone should have an interest.
Everybody in Grenada are stakeholders, basically, because you're a consumer, you're a stakeholder in what happens for the electricity. Public utilities or utilities themselves, they should be able to ensure that there is sustainability within a country, there is growth, there is economic development. So all players, everyone in Grenada is a stakeholder, and that's one of the main things that we're trying to bring across also, so that everyone can be engaged. So don't think about the regulations or what I'm going to say now, the different regulatory instruments that we have, the draft ones that we have for consulting now. They are not just for Grenlec. So the consumers, you yourself, me, myself, anyone in Grenada should pay a keen interest in what is happening.
The time allowed for comments to the draft will be 30 working days. While it is undertaking this round of negotiations, the PURC can decide, although not obligated, to conduct another public consultation inviting additional comments. The draft documents can be viewed at www.purc.gd/consultations. This is the National Report. We'll have more news after the break. Use and overuse of antibiotics contribute to a buildup of resistance to the drug over time. The Veterinary and Livestock Department of the Ministry of Agriculture continues to raise awareness on this issue. Karima Lewis tells us more in this report.
Antibiotic or antimicrobial resistance, the unfortunate occurrence of bacteria and fungi developing the ability to defeat drugs designed to kill them. This was the topic presented on by the Veterinary and the Livestock Department of the Ministry of Agriculture as they continue to raise awareness on the do's and don'ts of using antibiotics. The session, which was held at the Rose Hill Community Center in St. Patrick on Tuesday, was the second in a series of activities held by the department, the first being in St. David at the Marmount Community Center in the latter part of 2019. According to the department, the misuse of antibiotics contributes to the buildup of resistance by the body in fighting diseases in both animals and humans.
The medication that you might be using, let's say you're using medication A to treat infection B, and then after 3 months, medication A is no longer effective against infection B, then it's most likely that you have a resistance.
That was Dr. Kimon Cummins, the Chief Veterinary and Livestock Officer in the ministry, as he explains how one can identify when they are resistant to an antibiotic medication. Inappropriate drug use, lack of quality control in manufacturing, outdated drugs, and overuse of antimicrobials in the food industry are just some of the factors contributing to the resistance, said Dr. Cummins. Two of the most effective measures in dealing with antimicrobial resistance, he said, is the strengthening of governance related to antibiotics in food and agriculture and the promotion of good practices related to antimicrobial usage.
This to me is really critical, because you want persons to be very responsible with regards to the usage of antimicrobials. And when I say responsible, I mean you would not use any kind of prescription drug that was not recommended, or you weren't given direction as to how to go about using it by, a professional, or maybe a medical doctor or veterinarian. Or secondly, whenever you do get a course antibiotic, you want to make sure that you follow the directions. So if it says 7 days, you want to ensure that you go along to 7 days.
The session was attended by agriculture science students from the McDonald College and 4-Hers from some of the primary schools. 2 students from the secondary school and primary schools respectively relay what they learned from the presentation.
I learned that bacteria can build up a resistance to antibiotics and ways to treat it and treat cuts and sores that contain bacteria properly, and then they wouldn't build up a resistance to the antibiotics they use. My father is one, he used lots of antibiotics, so yes, I'll enlighten him on the dangers and stuff like that.
I have learned that rabies is like a disease. So if it starts as like say your foot, it will take a bit longer to reach up to your brain. But if it starts like your arm, it will take maybe around 21 days. And also, I also learned that rabies, when you see an animal foaming in the mouth, the best thing to do is to run. Because, there is almost no cure for rabies, so the chances of you getting out alive is pretty small.
For the Ministry of Agriculture, I am Karima Lewis.
Thank you, Karima. Finally, in the news, the Rehabilitation Unit of Her Majesty's Prison imparted pertinent information to students of the Boca Secondary School on Thursday as part of their prison outreach program. The program targets youth, especially young men, to highlight the ills of prison life and to influence youth to engage in behavior that will not violate the laws of the country. Member of the Royal Grenada Police Force, Shellon Hostain, attached to the rehabilitation unit, says youth are the ones most exposed to various influences.
Our aim is to visit all the secondary schools on the island and hopefully see how we could target even the primary schools, right? But it might be a difficult task. It's all about encouraging the youth to stay away from crime and violence, because what we notice is that the prison population has been increased by a heavy youth, by the youth, right? And that's why we try to target the schools, because we realize that from the schools where a lot of the crime development starts, even at primary school in this day and age, especially with the technology and the exposure to a lot of influences. So we have that influx of crime among the youth. So our outreach program is really tailored to prevent them from coming to prison.
He says the information disseminated to the students have impacted them positively.
There are some schools we go and the students get so emotional that, because you can actually see like it's happening to them, like certain things that they're doing. And we notice that even with the questions they will ask, it's really sensitizing them. So it is impacting the community, I should say, and the schools in that sense. Yeah, because, they're attentive and they do understand.
That story just ended the national report for today, Thursday, February 27th. Let's recap the top story. Government partners with a cybersecurity program to encourage safer online activities. On behalf of the entire news team here at the Government Information Service, I am Rikisha St. Louis saying thank you for joining us. Until next time.